Cardiac arrest is scary and needs immediate action. So we, of course, bring in 9 News medical expert Dr. Payal Kohli with us to learn more about cardiac arrest. Is it the same as a heart attack, number one?
No, not at all. In fact, a lot of people think a cardiac arrest is a heart attack.
I did. Me too.
Yeah, it's basically the heart stopping, but the heart can stop for a number of different reasons. So it could be a plumbing problem, which is blood flow to the heart. That's a heart attack. It could be an electrical problem. That's an arrhythmia. It could be the pump failing, which is heart failure, but it could also be a whole host of things like your body temperature gets too high or too low, your blood becomes acidic, you have an electrolyte problem, you have a blood clot. But the final common pathway, if anything that goes wrong in the body, the heart reacts. It stops, and then that blood flow to the brain stops.
Is this common? And does it happen at home? You heard the cardiac arrest when he was at home. He was, I don't know, healthy otherwise. We know he's a wrestler, but does this happen a lot?
It is very common, and it can actually happen to any one of us, which is why I think it's so important for us to be having this discussion. So 70% of cardiac arrests happen at home, and 90% of them, sadly, ladies, are fatal, just because it's such a dire situation where if you spend more than a minute trying to resuscitate the person without getting CPR, you could actually lose a lot of time. So we have 356,000 Americans that have cardiac arrest every single year. So every single one of us needs to know, A, how to recognize it, B, what to do in that particular situation.
And you being a cardiologist, I mean, this is your expertise. You know this better than anybody. So do you have any inclination, and I know you're just speculating on what exactly caused Hulk Hogan's cardiac arrest? Do you think wrestling had anything to do with it?
Well, it's interesting. Studies have looked at wrestlers, and they actually have a 15-fold higher risk of having premature death due to cardiovascular disease. And if you break down the reasons as to why that is, think about them. They're sort of amped up all the time, right? It's those stress hormones, that sympathetic nervous system that kicks in. So their blood pressure tends to be higher. They generally, just like Hulk Hogan did, tend to maybe use substances like steroids and such that can increase their risk for problems down the line. And then weight is a big problem amongst wrestlers because they're encouraged to be heavier. And so weight management can certainly contribute to cardiac arrest. In his case, we don't exactly know what happened, but what would be helpful is to know what the medical response team saw when they got there, what type of electrical rhythm the heart was in, because that helps us to know what went wrong. And sometimes if the family decides to pursue this, an autopsy where they actually look at the heart, look at the blood vessels around the heart, look at the lungs and see if there's a blood clot, also helps to give clues. But certainly we're mourning just with his family. Our thoughts are with them.
And when you're describing the things that a wrestler goes through, that can apply to a lot of other people too. Overweight, high stress. So how can we all, try to prevent this from happening, take preventative measures?
So I think the first thing is to be kind to your heart. We take our heart for granted until it stops one day, and it could literally mean the last day, your last day on earth. So really want to be careful with the substances that you use. You don't want to smoke, you want to exercise, you want to keep that stress level in check. But I would say look into your family history. Ask your parents, have we had any cousins who died suddenly or anyone who used to die in their sleep, especially our parents' generation or their grandparents, they would say, oh, they passed away in their sleep. That could be a cardiac arrest. And for most of us over the age of 40, we should get an EKG, which is an electrocardiogram. That's something that can help to diagnose electrical problems with the heart that might predispose you to have a cardiac arrest.
What about the minutes before? Was there any signs that something was coming, a cardiac arrest was right around the corner? Can you respond to that?
So sometimes there's a warning and sometimes there isn't. In fact, we have, some in-hospital cardiac arrest where the patient is standing there and the next minute you know that they collapse. So depending on what causes that heart to sort of suddenly stop and freak out, you may have a warning. He did have a neck surgery in the recent months, and there's some speculation online that this could have been a complication of the neck surgery and that, perhaps his health was languishing a bit. Hard to know exactly what happened. But it's really, really important the minute that somebody has a cardiac arrest. And I'm going to ask you guys, how would you recognize if somebody had a cardiac arrest? What would be the signs?
Geez, I wouldn't know because I think of heart attack
Breathing.
and stroke.
So that's a good one. So somebody suddenly collapses, loses consciousness, and then you don't feel a pulse, and they stop breathing. So where do you feel for a pulse?
Oh, right here.
Nope, because that's too far away.
Oh,
yeah,
okay.
So you want to look close to their heart so you feel their neck and see if you feel a little, and you should feel it on yourself so that you know where you're supposed to feel. And then you put your finger under their nose and look for any breathing and look for chest rise. And you don't spend more than a few seconds assessing. And the minute that happens, the first thing you do, have somebody call 911. The second thing that you do is lace your fingers together like this, lock your elbows, lean over their chest, and push 100 to 120 times per minute. and just keep compressing that chest until the defibrillator arrives, because literally you could save somebody's life with it.
Yeah, you might just have giving
I
us that
know.
information
Yes.
right here today. So we appreciate you coming in and having that conversation. And you can find more with Dr. Kohli at 9news.com/Dr. Kohli.